Welcome to today's press briefing on COVID-19 updates. We have with us Secretary for Health, Professor Lo Chung Mao, Head of Communicable Disease Branch of the CHP, Dr. Chuang Shok Kwan, and Chief Manager of the Hospital Authority, Dr. Sarah Lo. Professor Lo will first speak, and then Dr. Chuang will give us an update on the new number of cases, and then Dr. Ho would tell us about the HA. Professor Lo, good afternoon, everyone. Today I attend the press briefing on updates on COVID-19 again. I'm here to talk about two things mainly. First, an update of the epidemic situation, especially in relation to the latest figures of relating to patients in the hospital authority, as well as the worst case scenario contingency plan of the HA. In view of the possibility of an impact on the service of the hospital authority, we need to make the best preparation in the worst case scenario. And I'd also like to talk about anti-epidemic strategies that aim at precision and the implementation of real name registration under the Leave Home Safe app, as well as the use of red code and yellow code. First of all, I'd like to give you some information about the epidemic situation and its impact on our healthcare system. As you know, that number of new cases has been hovering at a high level. At the end of May, it was a low level of 3 digits. It's risen to a 4-digit figure. In the past few days, it's been hovering around 2,000 to 2,000 or so. The hospital authority has been put under more and more pressure. You can see on the diagram here from the beginning of June to yesterday, that is the 10th of July, within 1 month, patients receiving treatment in hospital authority has increased from 300 or so to 957 as at yesterday. The trend is rather obvious. It will exceed 1,000 very soon. We have 1,000 beds being used by COVID patients in hospital authority facilities. And the number of serious or critical cases, usually there is a lag of about 2 weeks from admission to the case turning into critical or serious. From the beginning of June, we had about 2 or 3 cases per day. In the past few days, it has risen to 8 or 9 cases, or even up to a double-digit figure. We look at accumulative serious and critical number of cases. In the past week, the daily figure has shown an increase. As a result, the hospital authority has planned for the worst case scenario. Currently, the number of daily admissions, which is the figure here, is about 150 per day. About 1,200 hospital beds have been earmarked for such use, and as I said, that close to 1,000 has already been used. We do not want other patients in the public healthcare system to be affected. In particular, those in a serious condition, in an acute emergency situation, and cancer patients. We foresee that in the coming 2 weeks, the number may increase by 100%. So at the end of July, there is a chance that the daily number of admissions will reach 300. So 1,200 to 2,500 beds will have to be mobilized. That accounts for about 10% of emergency beds. Services might be affected. The worst case scenario, there will be a 25% adjustment to public healthcare services. This is only an estimate. But we'd rather err on the safe side. We will prepare for the worst, but hope for the best. If we are to change this increasing trend, if we are to change the future so that the worst case scenario will not happen, we have to be more precise when it comes to our anti-epidemic efforts. This takes me to the second part of my speech. We aim to be more precise. In terms of our strategy, we aim at early identification and early diagnosis. So we have to make sure that PCR tests are convenient, speedy, readily available, and affordable. We also want to put in place more humane and people-based facilities. About 60% of those under quarantine are staying at their own home. As at yesterday, about 12,419 people are under home quarantine. They are confirmed cases and are staying at home. In order to prevent those who have been confirmed or those who are under quarantine from entering the community, thereby reducing the risk to other members of the public, we would like to continue to improve existing quarantine and isolation facilities. Starting from the 15th of July, we will require those under home isolation to wear a wristband to ensure that they will not leave their homes. We would not stay in a state of inaction. All our measures target people who have been infected. They carry the virus and they create risks to other people. So we have to make sure that home isolation is more precise while being humane. Regarding the Leave Home Safe app, when one is infected with COVID, their apps will change to a red code. The red code is to identify those who have been infected. This will stop them from entering certain premises. Those who are under home isolation, during the time of the isolation order, we need to make sure that they will not be allowed to enter certain premises, high-risk premises, say for example hospitals and care homes, and they are not allowed to go to high-risk premises that involves taking off of masks. We need to understand that these people are under isolation, and they are under an isolation order, whether they are staying at designated isolation facilities or under home isolation. They are not allowed to go out into the community. If we have the red code, that means that our strategies and the enforcement can be more vigorous. For those who are under quarantine, say for example those who arrive from outside Hong Kong, they have to stay at designated quarantine hotels. The government has heard different views. We understand the aspiration for better arrangements to connect with the rest of the world and to revive our economic activities. We want to improve on quarantine arrangements. Currently, we have a 7-day designated quarantine hotel arrangement. Well, as to whether it can be changed to health monitoring under a certain setting. That means people who have completed a certain number of days in a designated quarantine hotel, they can go to a home setting under health monitoring and will be managed under a point-to-point closed loop. So these people still pose certain risks to the community, so we need to restrict their movement from entering high-risk premises, say for example hospitals and care homes. And they're not allowed to participate in high-risk activities that involve the taking off of masks. That will be the category on which we will impose the yellow code. When we have the yellow code for identification, for arrivals who are supposed to be quarantined in a hotel, we may consider letting them going back to their homes under the quarantine period, when we can stop them from entering certain premises or participating in certain high-risk activities. That's one of the key areas in our precision strategy. Hong Kong is a place where there is rule of law. So when it comes to quarantine and isolation, it's done on a legal basis. Those under quarantine or isolation are not allowed to leave respective facilities. And if they do so, it is actually against the law. But in order to make sure that isolation and quarantine strategies are targeted, we do need these arrangements. And you must understand that the real name registration of the Leave Home Safe app is to help law enforcement and not to track and it not to restrict the freedom of those that are not infected. And I'd like to say that we would make use of technology to put in place a precision strategy. This is to reduce the cost in our fight against the epidemic and at the same time to maximize the effectiveness.
大家好，我哋琴日嘅本地陽性嘅個案總數係2611宗，包括1066宗係核酸檢測陽性。咁另外喺平台上報快速檢測陽性而核實嘅個案係1545宗。另外我哋有252宗輸入個案，包括199宗係核酸檢測陽性啦，同埋54宗係快速檢測陽性個案。死亡個案呢，醫管局今日呈報咗7宗嘅死亡個案。咁一陣間醫管局嘅同事會詳細講述嗰啲個案啦。咁而輸入嘅。
And for the 252 cases, 129 are picked up from the airport. 109 picked up from quarantine hotels, and 14 have already left quarantine hotels but were found positive. The CT values are relatively high, and some of them, the CT value were low. We will continue our investigation. Over 10 imported cases have been found, 17 of them from UK, 29 from Singapore, 22 from Thailand, 13 from India, 16 from US, and less than 10 cases from various other countries. As for care homes, one RCHE reported one positive case. That's a resident, and we are now quarantining the fellow residents. That is China Women Association Ying home. And this is Monday. Normally on Monday there are more cases because during the weekends there were also positive cases. So the positive cases today is 629. It's reported by 454 schools, including 152 cases that are tested positive today and 178 that were tested positive on Sunday, 175 were tested on Saturday, 122 were tested positive on Friday or earlier. For 627 cases, this covers 527 students and 100 teaching staff. They come from 101 kindergartens, 301 primary schools, 213 secondary schools, and 12 special schools. In the past week, 233 schools have reported 2 or more than 2 cases. We have looked into them, and we suggest the following 8 schools to suspend some of their classes for 1 week. They include the group of hospitals, Wang Yuka Kid Memorial School in Sai Kung. For its class 5B, there were 3 cases and there are 21 students, and it has to be suspended for 1 week. And in Chuman School, the class 6B has 4 cases and there are 18 students in the class. And for Kowloon Samyuk School, for B class, 4 students are infected. That class has 23 students. And for Kaisi Kindergarten, for DM class, in the SPM group, there are 18 students. 2 students are infected. As for Precious Blood Girls School, for its 4H class, 3 students are infected. There are 19 students in the class. And for York International Kindergarten, for its N1 red class, there are 3 students infected, 26 students in the class. There are 2 special schools as well. One is Taipo Honchi Pine Hill School, and they had 2 students that are infected. The classes are relatively small, and these classes have to be suspended for 1 week. And for 中華基督教會旺角堂啟愛學校 is in Sham Shui Po. Form 6, in Form 6, there are 2 students infected, so a class will be suspended for 1 week. And for variants, for local cases, there are 36 suspected cases, that is BA.2.12.1. For 19 of them, they are untraceable, and 14 of them are linked to other cases. Well, for BA.4 or BA.5, about 19 cases today. Well, some of them are epidemiologically linked, 6 of them are untraceable, and for 13 of them, they are linked to other cases. This is my report today. Thank you. Dr. Ho, good afternoon. There are 957 confirmed cases done in hospital. 121 of them are new cases. And for those in isolation wards, 339 of them were in isolation wards, and 20 of them are in second-tier isolation wards. 285 of them are in North Lantau Hospital, Hong Kong Infection Control Center. 95 of them are new cases. And as of yesterday, 1 new case was in critical condition, 4 in serious condition. And for the hospitalized confirmed patients, 17 of them are in critical condition, 31 are in serious condition, and 5 of the critical patients are in ICU. In the past week, the epidemic has deteriorated. The number of patients in hospital has been increasing. Last week, there were about 700 confirmed patients in hospital. 20 plus of them were serious cases. But for this week, we have 900 patients in hospital, and about 50 of them are serious cases. This increase is very significant. The HA will continue to monitor the situation, and we will deploy more manpower and resources to fight the epidemic. We will also adopt different measures to protect patients and staff. We hope members of the public will continue to be vigilant. If you haven't been vaccinated, please do so as soon as possible so that you can protect yourself and the people around you. In case you are infected, your disease will be less serious and the death rate will be lower. And there are 7 death cases, 4 male, 3 female, age from 65 to 90, and 4 of them passed away yesterday. 3 of them passed away on the day before, and 3 of them came from care homes, and 5 of them had taken 2 jabs. 1 has taken 1 jab, and 1 of them is unvaccinated. As for these patients, they all suffer from chronic illnesses. For example, stroke, chronic pulmonary disease, and some of them are cancer patients. In the past days, 79 people have recovered. 71 of them have been discharged from hospitals. As for since the beginning of the 5th wave, 32899 people have recovered, including 52629 patients who have been discharged. Ever since the beginning of 2020, 65,279 patients have recovered, and 65,009 patients have been discharged. And 5 patients were found to be positive when they were admitted to hospital. 6 patients in the same ward and have been classified as close contacts. 65 staff members have been found positive, and up to now, 24,780 staff members have been identified as positive, and now 24,451 staff members have resumed their work.
Thank you. Now the floor is open for questions. Please make use of the microphone we give you. Identify your media outlet and limit your number of questions to under 2. The lady in white. I'm from Now TV. I'd like to ask, we found that at the Shenzhen Bay Border Control Point BCP, and those who have been confirmed positive, they are allowed to leave. Secretary, you visited the BCP yesterday. If they're just allowed to leave, wouldn't that be a loophole? Will there be alternative arrangements made by them? Say, for example, transportation to send them to isolation, and if they choose to, can they choose to be isolated at home or in a hotel? Will there be areas for people to wait for their results, so that infected people can be separated from those who are not infected? Just now, it was mentioned that there will be the adding of red and yellow codes. Would you be worried that there will be more people who are infected but do not report their cases? And is it the case that a yellow code can be implemented this Friday? There is a mechanism in place to handle those who have been infected. If they are PCR positive, there should be an isolation order to inform them. Whether they will stay at home or at a designated facility, that depends on the home situation. Everyone should follow the same law. If we are to enhance our arrangements of home isolation, say for example wearing of a wristband and the red code, and if someone chooses not to report their infection, that is against the law. Not to mention, it's a risk to other people's lives. We should not allow such behavior. One of the reasons why we have to enhance our PCR tests. PCR test is not a self-reporting test. The PCR test is a requirement under the law. It is more precise and conducted by professionals. The identity of the person subject to the test is known, so we can check and verify the person's identification and send them to relevant facilities. The health code, that is the red or yellow code, help us to identify high-risk people. And it is something that we would like to be implemented as soon as possible. We will work with relevant colleagues for that to happen. Sorry, speakers off mic. That is an arrangement for the colleagues. Next. The one on the right, the lady in black. I'm from Mingpao. Professor Low, just now you talk about red and yellow codes. Do you have any data to support you? How many people have you found to have sneaked out when they're under home isolation? Why is there a need to launch the red and yellow code? Would you consider other alternatives that would not sacrifice people's privacy? Say, for example, to send these people to certain facilities. Would you consider enhancing law enforcement to resolve that problem? Just now you mentioned that for those who arrive in Hong Kong, some of them can change to home health monitoring. What are the details? Would they have to stay at a hotel for a certain period of time? What are the high-risk activities involving taking off of masks that you mentioned? And Professor Low, under the plan of the HA, the various stages, can you give us more details about the deployment and adjustment of beds, and what will be the services that will be first affected? We ask the professor to answer first. There are 12,419 people that are under home isolation. These people have been infected, and that is not a small number. And if you ask me how many people have been found to have sneaked out, if you use the word sneaked out, that means no one's any wiser. Currently, there is no way to prevent these people from breaking the law. That's why we need the implementation of the wristband as well as the red code so that we can implement home isolation with precision. And as to whether we can send everyone to designated places for isolation, undoubtedly that is more stringent. The social cost will be higher. That is the cost in terms of isolation facilities and further restrictions on their freedom. We want to strike a balance, especially those who have been infected. They need to understand that these measures are more humane. They're there to help them. The Secretary mentioned about a contingency plan of the hospital authority. Depending on the number of admissions on that day, we make adjustments to the deployment of beds. We've recently set up a high-level emergency command center. This has greatly enhanced our capability to react. We have the management of the 7 clusters in the high-level command committee. This will help us react very swiftly in making any adjustments. Within a very short time, we will be able to mobilize over 1,000 beds. If need be, within 48 hours, we're able to deploy over 10% of emergency and rehabilitation beds of public hospitals to receive COVID patients. That is about 2,000. And within 1 week, we are able to mobilize about 20% of the beds. That is about 5,000 of such beds. In relation to service adjustments, we're talking about scheduled surgeries and non-emergency treatment in hospitals. We're still studying data, including PCR test on the 3rd day. Once we're ready, we will announce the details. Next, the one in the middle, the lady in white in the 4th row. I'm from TVB. First, the yellow and red codes, when will they be implemented? Well, for Leave Home Safe app, as well as the vaccination record, it means it's under a real name registration. What do you say to that? Are you concerned that people will not cooperate and it will be difficult to implement the real name system? Now people use the Leave Home Safe app and the vaccination record to enter premises. If it's changed to red and yellow codes, does it mean that it's very different from the previous government? Will people with yellow or red code be restricted from taking certain modes of transportation? And the wristband, when will it be distributed? PCR positive or a certain number of days after confirmation? Would it be the case like previously when people had to wait for a few days after confirmation to have anything done?
Vaccine pass is vaccine pass. Its requirement is that a person has to be vaccinated before he can enter a certain premises. And there are no other requirements. So for vaccine pass, it cannot replace this new measure of using red and yellow codes. For red and yellow codes, it's about whether a person is positive and if it's high risk. For example, he's just arrived from other countries. So this is something that vaccine pass cannot do. And secondly, for red and yellow codes, would they affect people taking public transport? As for details, we will be explaining them to you later when they iron out. As for a person with a red coat, he shouldn't leave his isolation place. If a person has a red coat, it means that he's already confirmed and he has to stay in place for isolation and quarantine. He shouldn't leave that place. So, now if you take public transport, you don't need to use any code, but the most important thing is that he shouldn't leave his place. And also for yellow code is to protect people living or staying in hospitals or care homes, and also for high-risk activities. If you need to take off your mask, this will be also this is also something that we would pay attention to. And also for electronic wristbands, when an isolation order is issued, the wristband will be sent to the person. Theoretically, we would do it as fast as possible. We want things to be done as soon as possible. So when a person is tested positive, we will send a wristband to him as soon as possible so that the isolation order can be followed. And technically, we will be able to do it. And we will explain more to the public. These measures are to identify positive patients, and secondly, the high-risk people. Now, these people have to undergo quarantine, but we want to do it in a more humane way. We allow these people to stay at home. This will not affect ordinary citizens, and it doesn't have a tracking function. Let us answer an English question. Are there any English questions? This lady on the fourth row.
Hi, this is Phil TV News. So so we would like to know. We saw that there are some people in the in the Shenzhen Hong Kong Bay, they actually was carried the bracelet in red, which showed that they are the positive case. But it seems like the officials there didn't arrange any quarantine for them. And is there any loopholes actually exist in the so-called point-to-point transport? Will the government do anything try to solve the issues, and when? And also, we would also like to know if if the government is going to cancel the quarantine for inbound travelers, replace them with home quarantine or just monitoring. Thank you.
First of all, this is exactly what we want to ensure, that people who have got infection, who are infected with the coronavirus, should be properly undergoing isolation, either at home or in specified places. And this is exactly what the current new measures try to do, including the bracelet as well as the health code. The second question about the designated hotel quarantine for inbound travelers, we are analyzing the data, and we would consider every option, including changing some of the designated hotel quarantine into home quarantine or home health monitoring. And that's one of the reasons that we have to have effective measures, including the yellow health code that I've mentioned, to make sure that if we allow them for home health monitoring, they would not get into these high-risk areas and put our community at risk.
How right?
I have already mentioned that there is a protocol, there is a procedure for issuing of isolation order, and the relevant authorities are requested to follow all these procedures.
How right?
The lady in white on the fourth row. I'm from cable TV. Just now, the secretary said that for the 7-day quarantine now, you may change it to home quarantine and self-surveillance. So how long will that be? How many days? And how many cases now are only discovered after day 5, and how likely would they affect their family members? In Shanghai and Macau, they implement health codes as well, but they still have outbreaks. So why are you so sure that health code would be effective in Hong Kong? And people say that the government will only tighten its policies but not relax the policies. So when do you think we can relax these policies? How many cases should we be looking at? And for every place, they would implement their own measures. Shanghai is very different from Macau, and it's also different from Hong Kong. No matter whether it's the population or the demographic distribution, the living condition, vaccination rates, and for the economy and foreign connections, etc. So for all our anti-epidemic measures, we have to look at Hong Kong's situation. Now we have to fight the epidemic more precisely now. We have to look at our own situation. Our goal is that the number of cases should always go down. With such precise measures, we do not hope to increase social cost. At the same time, we want to reduce the transmission rate. Now, for a confirmed case, he may spread the virus to 2 persons, but we want this figure to go down. With such measures, we hope that home quarantines or home isolations, quarantines and testings can be bettered, and the transmission rates can be lowered. When the immediate reproduction rate is less than 1, our daily confirmed case will drop. This is our goal. We cannot compare with Macau or Shanghai in many aspects. We have a much bigger population than Macau. Hong Kong is a more international city. And in many areas, we cannot compare ourselves directly with these other cities. The gentleman there. I'm from Hong Kong 01. I would like to ask the secretary now to launch the red code. You want to identify positive patients, but you don't know how many people have sneaked out. Why don't you trust the people? What are the reasons? And with wristbands, why do you still have to launch the red code? Now, Mr. Siwing Hung, the Secretary for IT, said that there was no need to implement real name registration. Have you communicated with the last term? Is this the new method of the new term of government? You said that the number of cases has been increasing. Do you have plans to do what they do in Shanghai and Macau, that is lock down the city in certain areas? I'm sorry, you have been asking too many questions. I don't even have time to write down all your questions. Let me answer your question first. Otherwise, it would be very chaotic. I hope I can answer your questions properly. Just now you asked me, why don't I trust the people? As for isolation or quarantine, they are based on law. I believe Hong Kong people are of high quality. But why do we need police in Hong Kong, and why do we need courts in Hong Kong? We cannot guarantee that everybody will be law-abiding. And some people may not do it deliberately. They may just be careless, or they just forget to do something. So with these measures can help us to make sure that they comply with the rules.
The wristband is a way to help them stay at home. but there's been cases in which the wristbands have been taken off. So we need another line of defense. Given an increasing number of cases and the hidden transmission chains in the community, we hope to put in another safeguard to ensure that these people will not enter high-risk places. Change is the only constant. We have to keep changing. The epidemic changes, and we need to change our measures. Is not conflicting. The situation is different. Well, no one wants to hear anything about a lockdown. It's exactly because we want our measures to be precise that we consider these measures. The epidemic is affecting our lives. What we have proposed are precise, and it involves insignificant cost. We try to control people who have been infected or who are high risk of an infection. I don't want to use measures that carries a higher cost. Say, for example, lockdown. We don't have such plans. Last question. The lady at the back.
I'm from Bloomberg News. My questions are for Professor Low. So with the health code system has been in use in cities in mainland China like Shanghai and also in Macau, but they did not manage to stop the highly transmissible variants such as Omicron from spreading in those cities. How do you think Hong Kong's health code system can do better and prevent transmissions in the city? And my second question is about the incentive for residents to continue to self-report their infections through the CHP websites. If they will be given a red code and required to wear an electronic bracelet, wouldn't this discourage them from reporting their infection? And how will the health department look at encouraging residents to continue to report their RAT positive test results to the system? And my last question is about potential home quarantine for travellers. Is there a timeline that the government has for introducing a home quarantine for travellers to Hong Kong? And what factors should be in place for the home quarantine to launch? Thank you.
Okay, different cities have different considerations. Every city is different. Hong Kong is very different from Shanghai or Macau in terms of the number of the total population, in terms of the age distribution, and also in terms of the vaccination, as well as the fact that Hong Kong has already have the fifth wave, which has caused a widespread infection. We've paid the price. And in addition, Hong Kong is a very international hub. All these are considered when we design our policy. And that's why I would say that we would not just blindly follow any other's policy. The introduction of this health code of red or yellow is based on our existing COVID situation. The fact that we have over 12,000 people under home quarantine. And this doesn't exist in Macau or in Shanghai, all right? We're considering this target group, and by giving them a bracelet and by giving them the red code, we hope that we will be able to enforce the home quarantine in a more effective way and try to prevent these people from causing community outbreaks. So by reducing the chance of them getting into the community, we would be able to reduce the transmission from our current level and get to a lower transmission rate of below 1. But with that, we will be able to reduce the total number and protect our healthcare system. The issue of not reporting, I believe the Hong Kong citizens are of very high quality. And this is actually, COVID is actually an important transmissible disease and with legal implications. I would suggest Hong Kong citizens to consider the health perspective of the whole population. And if they have a red positive, they should report, and this is by law. And in addition, we will be using PCR in a more accurate and prompt fashion. And hopefully, because PCR is more following the medical standard, and all these PCR tests are done by medical personnel and with a proper record of the person's identity. And we will be able to make sure that those who are PCR positive will have the appropriate isolation order. Finally, about the home quarantine, I've repeatedly mentioned the present government would have to follow an evidence-based approach, and we have to change any policy based on data. We are considering every option, and if the data support, we are glad to consider any of the options available, including changing part of the designated hotel quarantine to home quarantine or home health monitoring. Thank you.
今日嘅就係會完結，多謝各位。
That's the end of today's press briefing. Thank you.